So today we're going to talk about canine aggression and what is the best treatment method for canine aggression. And you're going to find lots of stuff out there. And this study, which was done in the Journal of Veterinary Behavior in 2021, so it's quite recent, they looked at dogs that had been seen by behaviorists for canine aggression. And they wanted to try to figure out what was the most effective way to help curb the aggression. And the aggression they were talking about, one is they called conflict aggression, which used to be called dominance aggression, but we sort of got rid of that dominance idea. But that's aggression towards familiar people. And that is, the dog is, in the old terms, we say, well, the dog is challenging you. Now we know it's just due to a conflict, not true dominance. Also fear aggression, inter-dog housemate aggression, fear aggression towards humans and dogs, by the way, and also predatory aggression, which I just call predaceous behavior. But anyway, the key is there was 963 aggressive dogs that were in this study. 81% of them went to a behaviorist. And so you can imagine that, yeah, there's a lot of work done on these dogs. This is the key that really stood out. The use of equipment. And that is anti-bark collars, muzzles, and in terms of training equipment, decrease the possibility of successful aggression treatment. In other words, using those things did not help at all. And the most consistent beneficial behavior modification techniques were improved dog owner communication. And that's something that I'm working on all the time with my behavior consults, and that is I'm getting people to do regular obedience training. It's this thing where you're getting them to sit, lie down, heel on leash, come when called, that type of thing. But when you're doing those exercises, when you're working with your dog, you're creating a bond, and that means you have leadership. And then you have the chance to actually change their behavior in what they're doing. They're going to feel a lot more confident with you. So dog owner communication, very important. Relaxation protocols, I use several of those. For example, when we've got a dog that's barking when the doorbell goes off or there's someone at the door and they race you to the door barking like crazy because they want to go and jump on them, that's when we use relaxation. I also use it if we've got dogs that are excessively barking, or predaceous behavior, when they want to go and kill their prey. And in some cases, they're not going to actually kill it. You may have a herding dog that wants to herd kids. But being able to say, hey, whatever the dog's name, hey there, get over here and relax. But that's a training technique coupled with a behavior outcome. And then also they emphasized short, frequent training sessions. In other words, you got to keep on this and you got to keep practicing it. Medications, this is important for ones thinking about, gee, is there a pill for this? The traditional to prescribe medications are fluoxetine, which is Prozac, trazodone. They were not helpful. And they may create a bit of a drowsy dog, so you're seeing less of the behavior, but it's not changing the core, it's not doing anything like that at all. And so what that sort of tells us is that, gee, there's a lot of things here that are being done that aren't that effective. And what's really needed, of course, is working with your dog to be able to get the behavior changed using behavior techniques. And that is the key. Get some help with dogs rather than trying to find the magic pill or the magic harness or whatever to try to turn them around. If you need help, I can help you with a consultation, so keep that in mind. Anyway, have a good one. I'll see you in the next video.